Marines. As the medical officer of the Marine Corps, threats to force health protection are a matter of grave concern, both to me and Marine leaders everywhere. One such threat is Ebola, an extremely deadly viral disease for which there's currently no vaccine or cure, and one that's caused recently an increasing number of cases and deaths in West Africa. In fact, the ongoing Ebola outbreak has already surpassed numbers from all previous outbreaks since 1976, combined, making it not only the largest outbreak ever documented, but also the first recorded in West Africa. Although this situation is serious, the Centers for Disease Control, along with other government and international agencies, are taking steps to respond. The World Health Organization has declared the current Ebola outbreak a public health emergency of international concern, and the CDC has recommended against non-essential travel to affected countries. For those of you whose mission requires deployment to these areas, it is imperative that you take appropriate precautions. You must be aware of the risks, understand what to do if you come in contact with someone suspected of having Ebola, and what to do if you become ill. While there's currently very low risk to Marines and sailors in Africa, that risk can become moderate to high if you come in direct contact with an infected individual. It's important to know that persons infected with Ebola virus are not contagious until symptoms appear. The virus is spread through direct contact with blood or body fluids of a person who's sick, or with objects such as needles that have been contaminated with the virus, or by touching or eating infected animals. Therefore, avoiding these situations is crucial. Ebola is not spread through the air or by water. Initial symptoms usually appear suddenly, about 8 to 10 days after exposure. They can include severe headache, aching muscles, fatigue, sore throat, dizziness, nausea, and joint or muscle pain. As the infection progresses, increasingly serious problems can develop, such as blood and vomit and feces, skin rashes, failure of multiple organ systems, and shock. Unfortunately, we don't have specific antiviral treatment at this time, and there is no current vaccine. Meticulous, supportive care can make a difference, though, if it's begun soon enough. That makes early recognition of Ebola important in order to provide appropriate patient care and prevent the spread of infection. If you think you may have been exposed to the Ebola virus, please let your medical provider know right away. Recommendations and guidance may change as new information becomes available. For additional information, or to learn more, I encourage you to review the policies within your chain of command. And you can log on to www.cdc.gov for real-time updates. Our duty in medical is to make sure that force health protection recommendations change along with threats. So please stay current on this issue. Your health is vital to mission accomplishment. Semper Fidelis.
How dangerous is it?
Ebola is a virus. It's what we call a hemorrhagic fever virus. So it causes high fever, it causes bleeding, and it's a virus that's found in Africa, usually in bats, and then spreads to people. It's a highly lethal virus when it gets into a person, with 50 or 60% of such people dying once they develop symptoms.
How does Ebola spread?
Well, once people develop symptoms, the virus is in various bodily fluids. It's in blood, it's in vomit, it's in diarrhea. We think it can be in tears or in saliva or in sweat. So the virus is spread through direct contact with an ill individual with Ebola, and contact with their bodily fluids, or sometimes direct contact with the body while the person is alive or while preparing the body for burial.
Why is Ebola spreading?
Well, within the African countries where it's spreading, it's primarily a function of poverty. These are among the world's poorest countries, and they basically have very, very little money to spend on health and health care. So even the most rudimentary things that you might have readily available here, such as gloves and masks and gowns, are typically not available to a healthcare worker in countries like Sierra Leone and Liberia.
What should we be doing to keep safe?
Well, I think we as a country need to be helping these countries deal with the problem within their own countries. we as individuals here in the United States really can go about our normal business. Unless someone is either traveling to the region or in direct contact with an ill individual from one of these countries, they're really not at risk of Ebola, and they really don't need to change their day-to-day activities.
What's the role of the School of Public Health?
Well, I think there are basically two roles. Some of us on the faculty provide guidance and run advisory committees to the World Health Organization and the CDC. But in addition, we're training many of the people who are actively involved in the response to Ebola. So people who are leading the response both at the World Health Organization and at the Centers for Disease Control and Prevention in Atlanta happen to be alumni of the University of California, Berkeley School of Public Health. So I think the training function, making sure that the people who leave our school are well prepared to go into the field and deal with these types of problems, is certainly one of our contributions.